My name is Ben Harris. I work for Private Healthcare Australia. We're the peak body for health insurers in this country. 15 million Australians have got private health insurance, and I'm really passionate about making sure that people can get the best out of healthcare across Australia. Transparency is really, really important to consumers. Making sure that people know what they're going to be charged and how they can make sure they can get what they need and without breaking the bank. And private healthcare is an incredibly important part of Australia's health system. It works hand in hand with Medicare to make sure Australians have got one of the best health systems in the world. Premiums are basically the amount of money you pay into a big pot, and then the health funds take money out of that pot to pay for hospitals, to pay for medical devices, and to pay for doctors. So it's like every other insurance. It pools the risk and it makes sure that no one gets bankrupted by their medical care. So the role of the health fund is to pay some of the difference between Medicare and what the doctor charges, or come to an arrangement with the doctor so the patient doesn't pay any out-of-pocket costs. Nearly every hospital in Australia has got deals with health funds to make sure that patients are covered for the hospital part of their treatment. That includes the accommodation and make sure nurses get paid to look after you. It includes food, electricity, and everything that goes into really good hospital care. Private health insurers also have relationships with some doctors, but doctors can opt in or opt out as they see fit. Informed financial consent is simply, do you know how much this is going to cost? If the answer is no, then you do not have informed financial consent. It's really important to know exactly what the operation is going to cost you. Not what one bit of it is going to cost you, but what all of it's going to cost you. So you need to know what the surgeon's going to charge, you need to know what the anaesthetist is going to charge, and you need to know what all the other doctors are going to charge. All of these things can add up really, really quickly. The thing that we find with private health insurance customers' complaints is they're okay paying an out-of-pocket cost when they know what it is, but they're furious when they don't know what it is. Consumers need to ask questions. If you're unsure, just keep asking. The doctors are really good in Australia, and they do want to help you. Write things down, make sure you're really clear. And if you're not clear, ask. You can also ring up your health fund, and your health fund will be able to tell you if they have arrangements with particular doctors, which have either no out-of-pocket cost or a known out-of-pocket cost. We need everything to be as transparent as possible, and that includes individual doctor fees. Every doctor in Australia should have their prices on the Medical Cost Finder website. The more consumers can get the information they need, they'll be able to make better decisions for themselves and their families.